This podcast episode is based on the book Eminence, The New Standard for Plastic Surgery Marketing by Jen Ahlsten, published by Vitruviani in 2026. Chapter 6. How Patients Interpret Before and After Images. Surgical photography is one of the clearest demonstrations of a surgeon's aesthetic judgment and technical ability. Poor photography, quality costs patients. Even though before and after, photography is one of the most powerful assets a surgeon has for communicating their surgical results, a large audit of Instagram before and after photography found that approximately 40% of posts scored in a low quality range on standardized quality criteria. Lighting, zoom, and timing were among the most frequently neglected elements. This is an issue because patients may not fully separate clinical quality from the photographic quality when evaluating results online. A surgeon with exceptional technical skill but whose results are poorly photographed may lose patients to surgeons whose results are presented more clearly. Patients researching a procedure may compare several surgeons simultaneously, viewing their results side by side across websites and social media. This means that the quality and consistency of photography can strongly influence how a practice is perceived relative to competitors. Practices that invest in high-quality result photography can still stand out in a field where inconsistent presentation remains common. Despite the recent popularity of video content, prioritizing result photography remains a top priority. A survey research on plastic surgery social media found that photo posts were preferred over video posts, and that before and after results were the most influential factor in plastic surgeon selection via social media. Patients are likely to value static before and after photographs over video because they allow direct visual comparison when evaluating surgical outcomes. Technical failures that undermine credibility. The same failures appear repeatedly across surgical galleries, and most are preventable without a dedicated photographer at every session. Marked floor positions for patient placement, a fixed lighting setup, and a written posing guide allow any trained staff member to produce images that meet a consistent standard. Blurry images and low resolution can make surgical results appear less precise than they are, a problem that is reduced by regular lens cleaning, proper camera settings, and test shots before each session. Lighting conditions are equally consequential. Natural window light varies by time of day, weather, and season. A fixed, dedicated lighting setup, positioned identically for both the before and after photographs, is the most reliable way to control this variable. Inconsistencies in camera angles and patient posing create inconsistencies between the before and after shots. When a rhinoplasty patient is photographed with the head tilted downward before surgery and neutrally positioned after surgery, the images create a visible difference unrelated to the surgical result. Head alignment, arm placement, posture, and facial expression should be reproduced as consistently as possible. When a patient is photographed with a neutral expression before surgery and smiling afterward, the perceived improvement may exceed the actual surgical result. Written posing protocols can reduce these inconsistencies. The background should remain understated so that attention stays on the patient. Neutral background colors help maintain natural skin tones and help match the result photography to the practice's brand color palette. Photo retouching should be limited to technical correction, such as white balance and exposure correction, without altering anatomy, scars, swelling, skin texture, or the surgical result. Ideally, all images display the same white balance and lighting conditions and display skin tones correctly. The impact of a lens's focal length is rarely discussed, even though it can significantly alter how the result appears in photos and affect the apparent shape of the face. When a camera is positioned close to the patient's face, facial proportions become distorted. The nose appears larger and more projected, the chin appears smaller, and the midface appears wider. Patients are typically looking for a case that resembles their own starting anatomy, a reference point for projecting what their own result might look like. A before and after gallery dominated by a single patient demographic can make the practice appear specialized in a narrow range of anatomy. A gallery that includes both subtle refinements and more dramatic transformations, where applicable, helps patients understand whether the practice's aesthetic range aligns with their own goals. Executing before and after photography responsibly entails implications far beyond marketing, involving patient privacy and professional responsibility. Displaying photographs without explicit written authorization can expose a practice to considerable legal and reputational risk. For this reason, explicit written consent should be obtained and documented at the time photographs are taken, with clear records of how images may be used across websites, social media, advertising, and educational materials. Transparency in result presentation. Before and after images are subject to inherent limitations. Results may have been captured at a misleadingly favourable point in recovery. The same procedure photographed 2 weeks post-operatively can be misleading if presented as a final result. Photographing the result from a certain angle or under lighting conditions that alter the outcome can also distort the expectations of the prospective patients. Contextual information directly addresses the sources of doubt. Brief captions indicating when post-operative images were taken help patients calibrate their expectations against their own recovery timeline. Explanatory notes accompanying before and after photographs help patients understand which changes resulted from surgery and which characteristics remain unchanged. Practices that openly recognize subtle imperfections or limitations can communicate honesty and are likely to create greater patient trust. Video can serve as a valuable secondary format alongside static before and after photography by adding a sense of dimensionality that photographs alone cannot fully convey. A rhinoplasty patient slowly turning their head on camera allows viewers to observe the result from multiple perspectives rather than a single, carefully selected angle. Used in this way, video can strengthen credibility when filmed under consistent, transparent conditions by reducing the perception that outcomes depend primarily on pose, lighting, or angle selection. Eminence is available on Amazon and at Vitruviani.com. Next, Chapter 7, Tone as a Reflection of Brand Identity.